Last month, Kenya topped the list of African countries to record the highest average increase in COVID-19 infection and deaths, pointing to the extent of the spread of the deadly virus in the country. The Ministry of Health now says it is stepping up the vaccination program by procuring more doses and expanding administration of the jab, as Olive Barrows now tells us.
Number one, from behind. That would be Kenya's current position on the continent where containing the coronavirus is concerned. In a trend analysis of the last 4 weeks, the African Union and Africa Center for Disease Control and Prevention have flagged Kenya as recording the highest average increase in infections on the continent, a 53% average increase compared to Ethiopia's 21% and Egypt's 2%. Worryingly, Kenya has also recorded the highest average increase in new deaths by 55% to Ethiopia's 21% and the Democratic Republic of Congo's 27%. And with the virus mutating at an alarming rate, the war against the coronavirus has been framed as a race against time. The World Health Organization lighting a fire under nations across the globe to speed up the vaccination process as the COVID variants prove not only more virulent, but access to vaccines, particularly in the developing world, is proving a challenge. India joining the European Union in taking the decision to put their needs ahead of those of the rest of the world.
Indeed, yes, we are getting our Oxford AstraZeneca vaccine from India, and the subcontinent of India is experiencing a very serious upsurge. The government of India felt that they needed to rechannel production of most of those vaccines for domestic use for a period of time so that they can tackle their problem.
It is a fact that there is a global problem in the supply chain of vaccines. Every single country is having problems accessing vaccines.
Nonetheless, the Ministry of Health says it remains confident that Kenya will receive a second shipment of 2.5 million doses of the AstraZeneca vaccine in a month's time and a total of 20 million doses by year's end.
We are looking at alternatives, also new vaccines that are coming on board now. So there's quite a bit of frantic engagement behind the scenes in trying to see how we can get additional sources of the vaccine.
Nobody who has taken their first dose, and that I can give you complete assurance, is going to miss out on their second dose.
And if worse comes to worst, the Ministry of Health assures it still has a reserve of 300,000 doses at the National Vaccine Depot.
So with 300,000 doses, 100,000 can start the second dose in May.
And as demand for the vaccines grows, the Ministry of Health has called for patience, advising the public against taking the risk of falling victim to persons not qualified to administer the vaccine.
The way the needle will enter the muscle, deep into the deltoid muscle, is so important. The way the vaccine is stored in the refrigerator, it has to settle down. You do not rush, you do not shake those vaccines, AstraZeneca in particular, because if it has some of those bubbles which may form as you transport, then when it is injected in you, it will cause quite some pain inside the muscle.
Olive Barrows, NTV.